Hello everybody, my name is Dr. Conrad Tamea and I'm a board-certified orthopedic surgeon. Within the painful, dysfunctional, and injured knee, there are literally a host of conditions that may require medical attention. Adequate treatment depends, first of all, on obtaining an accurate diagnosis as to the primary cause of knee dysfunction and pain. I will do an extensive history and physical examination. I will ask you questions regarding the onset, the injury, the restrictions, and the therapies that you may have used in order to obtain relief. I will do a physical examination. A physical examination requires testing the range of motion, deficiencies or absence of range of motion. We'll check the stability. We'll check areas of localized tenderness. We'll check for crepitus, which means grinding within the knee joint. We will look at the laboratory and radiologic information. The MRI will perhaps say there's a tear of the medial meniscus, perhaps there's patellar tendonitis, but it will not say this is the condition that is causing your problem, your pain, your dysfunctionality. Or it will not point directly to the injury that may have led to your problem. That requires, as I mentioned before, a thorough history and physical examination. And I am committed to spending the time with you that is required to obtain that accurate history and physical examination. So often I find that a patient will come to me after exhaustive efforts to get relief, and they will say the doctor spent 30 seconds with me. Well, that's not an adequate time. It takes a period of time of listening, asking questions, looking, and examining to come up with the exact diagnosis. In the course of my orthopedic career, which, as I said, extends over decades, my concept of knee pain has evolved hugely, and as a matter of fact, it continues to evolve. I have embarked upon a search for effective therapies that are, in fact, an alternative to surgery. Many times the orthopedic surgeon will recommend a cortisone injection. It is short-lived, and as we all know, cortisone carries a potential downside. There is a limited amount of cortisone treatments that can be given to any knee. Cortisone is what we call catabolic, which means that it destroys normal and healthy tissue. The cortisone shots last for 3, maybe 4 months, and then they're repeated. And by the end of a year or so, the knee has deteriorated to the point where, according to the orthopedic surgeon, surgery is required. After we've completed the physical examination, we've looked at the MRI, then we have to consider what we call a guided injection. Now, a guided injection utilizes a diagnostic and therapeutic tool known as ultrasound. We can apply ultrasound to the knee, and we can look at the interior and exterior portions of the knee, and we can hone in very effectively on the target area that requires healing. So let's just take an example, quadriceps tendonitis, okay? There's no effective surgical treatment for quadriceps tendonitis until the quadriceps tendon ruptures. I have treated dozens of these in my career, and it is a horrific injury. It requires operative intervention. All told, the recovery period easily lasts 1 year. And guess what? The return to function is rarely 100%. I have found that regenerative therapy is an excellent way of effecting relief, and in a fairly short period of time, perhaps a month, perhaps 6 weeks, depending on the nature of injury, and a return to a very reasonable level of normal function. I have treated hundreds of knees with regenerative medicine, And what I have found is that using ultrasound, I can drill down and find the exact problematic condition within the knee, and then I can administer specific therapy to that region rather than just, oh, let's inject cortisone into the knee. So let's say, for example, quadriceps tendonitis. We will inject a product called Wharton's Jelly. This is a product that is found in the umbilical cord, and it is an exact biological duplicate of the connective tissue that we find in tendons and ligaments of the human body. So in effect, we can do a non-operative graft to an injured tendon. Okay, so when we look at the potential effectiveness to an injection inside the joint, we are completely omitting the significant conditions which can occur outside the joint. But let's take a look for a moment at the total knee, which has had a less than favorable result. What I have found is that there is often a bone spur or a inflammatory process occurring as a result of the surgery, which requires specific and targeted therapy. I have seen patients where a doctor has recommended a revision of a total knee, and after regenerative therapy, using ultrasound guidance and targeted therapy, the patient's condition has healed in a very short period of time without surgery. Regenerative therapies have to be applied just like a mechanic fixes your car. He has to know what the problem is, and he has to know how to fix it. He can't just do a few simple steps and hope to target the problem. So what we do differently than many clinics which are practicing regenerative medicine is that we target the area that requires healing. And as I said, we use ultrasound primarily for this, but we also use video fluoroscopy for the hip, and we will precisely target the area which is inflammatory, which is causing pain, or which is causing ligamentous instability, and which is causing dysfunction, and from which you need relief. So I would like to invite you to visit our clinic. Come and tell me about your knee. I will listen very carefully to you. I will discuss my findings, my opinion, and I will discuss alternatives with you, and I will discuss surgery. Don't forget that I practiced orthopedic surgery for 30 years, and I know when to operate. As a matter of fact, I have had many different orthopedic operations on myself, but I'll tell you one thing. I would much rather be treated with a needle than with a knife. Later on, the next episodes, we're going to talk about the shoulder, we're going to talk about the spine, and other joints and musculoskeletal conditions within the human body, and I look forward to hearing and speaking with you then. Give me a call. Let me help you get back to your fullest life. Thanks for listening.